Florida's Agriculture Commissioner Nikki Fried is not mincing words. Cabinet member says Governor DeSantis has lost control of Florida's COVID-19 response. Fried says if the spike and record-breaking numbers are not proof enough, his policies are simply not working, and he's recklessly reopening Florida despite the data screaming for caution, refusing to acknowledge the alarming patterns in cases, hospitalizations, and positivity is not only arrogant, but will cost lives, public health, and our economy. Commissioner Nikki Fried joins us live now on the morning show. You know, Dr. Kotke with the Vaccine Center at Children's Hospital in Houston said quite emphatically, stop screwing around. And I asked this question of an epidemiologist we talked to at 7:40 this morning. Is Florida screwing around? What do you think?
Yeah, I don't know necessarily that they're screwing around. It's just, when the governor goes around and claims mission accomplished and press conferences yells at the press for continuing to ask questions about COVID, unemployment, and yells at them for asking this, that we've beaten this and we've won, it almost seems like he wants to ignore the facts. And that's just very dangerous for our state and for our economy. We know that Florida's tourism is number one economic driver and agriculture is number two. If we don't get this under control, there's no way that people are going to be coming back to our state for traveling purposes. So we've got to take this seriously. We've got to step up into leadership. We've got to be honest with the citizens of our state about exactly what is happening with the numbers and making sure we're taking all the appropriate precautions to kind of get this back into control.
So the governor did move to stop alcohol sales at bars. Is that enough? What other steps should be taken?
Yeah, there's a lot of steps that could have been taken, should have been taken, and needs to be taken. I was very hopeful when he launched, the reopening task force plan that was very methodical, very data driven, had certain points that needed to be met in order to get into phase one, to get into phase two. And then the implementation just went out the window. Things were being opened up arbitrarily, going into phase two arbitrarily without meeting those benchmarks. And so we should have been following the data driven aspects and making sure that we were opening according to the data. That's one. Two, we also know that wearing masks has somehow become politically charged. This is not a Democratic or Republican issue. This is a human rights issue. So a human issue. And so I have called for a statewide mask ordinance because, again, if we're all going to be in this together, we need to all be in this together. We know that masks won't stop the spread, but it certainly will slow it down. The other aspect that we haven't done any of is enforcement. We left it up to the locals to really go into whether or not a bar, a restaurant, a gym, any other establishments are actually meeting the right regulations and compliance. And so what I'm asking for is for citizens of our state, we actually opened up our own consumer hotline earlier this week to take complaints and reports from citizens across the state of Florida so that we can help with the actual compliance. So that's two things. And three, obviously, moving forward into any more reopening is obviously not safe. And the other part is to be honest with the citizens. You can't keep kind of blaming different sectors of our state, whether at one point he claimed the high spikes are because of Hispanic workforce. Next is the spike because of our youth, socializing too much. The reality is that we need to be in this together. We need to have comprehensive enforcement, and we need to make sure that we are giving all the right information to the people of our state so that they can take their own personal precautions as well.
Now, we do have masks. An ordinance now here that went into effect just at 5 o'clock last night. Let me ask you about the testing data, because there are some people who are saying the numbers we're getting, they're not accurate. And the CDC basically says the numbers may actually be 24 times higher than what we're hearing. The hospitals we're hearing are not being forthcoming with the number of beds that are available. What do you know?
Yeah, and that's been something that I've certainly have raised a huge concern on and have been very critical of the governor because we were hearing deceptive reports coming out even from, February, March, that we had cases here in the state of Florida and the governor wasn't telling the citizens of our state that we had community spread, who actually was denying it. Then we heard, the problems that we didn't have the right numbers coming out of the nursing homes, the prisons, that the DeSantis administration told medical examiners to underreport or not report COVID deaths. Same thing that changed the numbers of how we report ICU beds. And so that's really a concern that when you're talking about a healthcare crisis, and having to have people make their own personal decisions, and businesses, whether or not they're going to open, what type of precautions. If you're not giving all the correct information to the citizens and under reporting numbers, you're putting people in risk and in jeopardy. And I think I even heard this morning that the U.S. military is banning service members from traveling to the state of Florida. That means that everybody else is taking this seriously. So we need to get the information correct. And going off to also, once that we all heard the story about Rebecca Jones, who used to work at the Department of Health, who resigned, or excuse me, was fired because she claims that she was being told to manipulate the numbers. So that really creates a huge trust factor that the governor is failing in. And how do we move forward if the citizens of our state can't trust the information that's coming out of our government officials?
And look, you talk to some health officials and they say in about 2 weeks' time, there is concern there won't be ICU beds available and hospitals will be overrun.
Yeah, that's one of the first concerns that I raised when I had asked for the closing down of our state 3 weeks prior to the governor doing so. The concern for one, that the overall spread of the virus. Two is the drain on our healthcare system, that if we run out of beds for patients that need it for COVID, or actual, individuals are still going to have car accidents and they're still going to have, heart attacks. And so we need to make sure we have enough bed space for all those patients as well. And then obviously the rebound of our economy. If we couldn't have gotten this under control, people aren't going to travel back to the state of Florida. So these are definitely huge concerns as we're seeing these numbers tick up all throughout the state on the amount of hospital beds that we have available. And we're seeing it across the country as well, as spikes are happening all across the country.
According to the Health and Human Services Secretary, he said time's running out here to stop the spread. Are you worried that we're running out of time?
I am. I'm worried that at some point there will be no ability to control the virus, that it's going to be so widespread that if you go out and you patronize a restaurant or go to the gym, I'm a huge gym fanatic. I would love nothing more to get up every morning and go back to my gym. But unfortunately, I was just hearing a case yesterday here in Tallahassee that there was a fitness class at one of the CrossFits here in Tallahassee that one individual in that gym, tested positive. So does that mean the entire gym now has to be quarantined? And so these are different things that are happening every single day that you're hearing about. And that if we don't have a comprehensive plan, and that our governor and our president are actually taking this seriously, I think that's part of the problem too. When the governor has blamed the spike for the youth because they aren't taking it seriously, I wonder where they learned that from. Our governor doesn't wear a mask. I think maybe until just recently, we're starting to see some of his team members wear masks. The president certainly doesn't wear a mask. And again, they've all claimed that we've beaten this, that we've stopped the spread, we've flattened the curve. And so everybody has let down their security guards. And when that happens, people were going back out and socializing in groups, hanging out at friends' houses, hanging out with people that may have been exposed. And so if we don't get this under control now, we are really going to have some issues. And then, of course, you guys in Jacksonville have the RNC coming at the end of August. And so now we're putting not only the citizens of our state at risk, but the 50,000 plus individuals that will be traveling to Jacksonville, which, of course, it's a great for our economic boost. But at what cost? Is that the cost of the lives of those who attend and those that are in the surrounding areas in Duval County?
So how do you get the governor's ear about that? I mean, you told me that you haven't talked to him in 3 months. Do you have other allies in the cabinet or in state government that can basically say, hey, look, Governor DeSantis, we've got to change the culture here right now. And this has become a political hot potato, and politics, when it comes to a health crisis, really shouldn't play a role.
Yeah, I think that's probably one of the most heartbreaking aspects to this. Is really how this has become a partisan divide. And you're right, the governor, as probably most people know at this point, and I don't talk. We haven't had communication since the pandemic started. I tried reaching out to him on numerous occasions and to his chief of staff to talk about agriculture. Our feeding programs, we're in charge of feeding all of our children in the state, working with all of our food banks. Agriculture now is #1 economic driver. So we tried to reach out and try to talk to him. And unfortunately, never received any phone calls back. I was left off of the task force for reopening. And then, in fact, last week, the Florida Congressional Democratic Caucus wrote a similar letter to the governor asking for a meeting because they, too, have been unable to get anybody inside of the office. I think it comes down to the citizens of our state have to step up. that our mayors and our local elected officials have done a fantastic job protecting the citizens of their own state. And we just continue having to elevate our voices because that's what's really disheartening about all of this is that the governor has surrounded himself with people that are yes men and women and have not challenged him internally or have not come to the table with different opinions to kind of balance what's happening out there. You've got people all across the state that are worried, that are scared. My mom just went through a year and a half of cancer and chemo treatment. I have a 90-year-old grandmother, and they've been locked up for 3 months. They feel like, what kind of advice do I tell them to be able to go out to your food stores? My grandmother, all she wants to do is play cards with her friends. And until which time that we get this under control and the governor starts listening to those voices, those people that are really hurting right now. The unemployment system is still a mess. You still have people that are worried about going back to work because they may be exposed. So until which time that the governor starts to step up and really understand not just the business climate but the individuals, start showing empathy to the individuals of our state that are really concerned about the spread of COVID.
And if Dr. Fauci is right, this virus is going to be with us at least for another year and a half. Commissioner Nikki Fried, thanks very much for your time. We'll be right back.
Thank you.